Local people's experience of services and living with sensory impairment. The Sussex Health and Care Partnership have, as of February 2021, an ophthalmology transformation programme underway across Sussex. The aim is to deliver recovery and restoration through transformation, a combination of efficiency and productivity, outsourcing, service redesign, and digital enablers. To address issues the NHS has identified. The pandemic has had a negative impact on waiting times, which has overshadowed the fact that in Sussex, ophthalmology performance has been declining for West Sussex patients. The voice and experiences of local people, detailed here following a number of surveys, focus groups, and other forms of engagement, will help to inform this programme. We will be emphasising the need to create a comprehensive pathway and greater collaborative working, so people living with a sensory impairment can get the right support when they need it, not just clinical interventions. The partner organisations within the Sussex Integrated Care Systems have committed to involving patients, as well as other stakeholders, to implement change. The Sussex Integrated Care Systems have a shared ambition to introduce standardised pathways, utilise technology, and implement national best practice to optimise patient outcomes and improve their experience. We note that low vision services are out of scope of the main transformation programme and believe this service is commissioned by the local authority. Similarly, the experiences of people living with hearing impairment will be shared with our system leaders to make sure they understand what needs to change so people are supported to live well and independently. Introduction. West Sussex County Council is refreshing its strategic sensory impairment needs assessment. A needs assessment is a way of assessing the current and future, in this case for sensory, health, care and well-being needs of the local community to inform decision making. It is important that there is a robust understanding of local need identified from residents living with or supporting someone with sensory impairment, those providing support, service providers and statutory services across West Sussex. Healthwatch West Sussex, as the independent champion, in partnership with specialist community organisations, has been asking people of all ages to share their views and experiences. Additionally, we have worked in partnership with the organisations providing services and support. By engaging with people, communities and service providers in this way, we hope to understand what is working well, what needs to change, and understand where there are unmet needs. Having done this, we will seek to use this to inform future provision so people can live safe and well with their sensory impairment. From the start, we knew it was important to make sure the whole of the county was covered. We achieved this through the breadth and variety of activities undertaken. We also use this as an opportunity to better understand the local impact of COVID-19 pandemic and lockdowns on those with sensory impairment. The engagements had three main parts: understanding experiences gathered through face-to-face engagement conducted virtually due to COVID-19 pandemic and lockdowns. Foresight Vision Support held 3 virtual focus groups with members living or supporting someone with visual impairment between December and February 2021. Healthwatch joined the Macular Society support group Midhurst Telecall in December 2020. Healthwatch joined 2 Alzheimer's Society virtual groups in December for people living with dementia and hearing reduction or loss and their carers. 2 virtual focus group sessions were planned for February for Royal National Institute for Blind People members, but were cancelled due to low attendance. In all, 53 people joined these focus groups. The focus groups questions were co-designed in conjunction with people living with and or supporting someone with sensory impairment. and supported by service provider expertise. To ensure we engage widely, a story gathering sheet was distributed to those who did not wish to join a focus group. Feedback from 130 people who completed one of 4 online surveys: adults with hearing loss or reduction, 18 responses; adults with visual impairment, 77 responses; children and young people with hearing loss or reduction, 22 responses; children and young people with visual impairment, 13 responses. Each survey was available between 25th of January to the 21st of February 2021 and accessed through the County Council's Citizen Portal website. The surveys were advertised through social media, through local newspapers and updates from West Sussex County Council, the voluntary community and social enterprise organisations. Survey questions were designed with people living with and/or supporting someone with a sensory impairment and were supported by service provider expertise. Feedback from providers has been reported separately to the review lead. Summary. Healthwatch West Sussex, as the independent champion in partnership with specialist community organisations, has been asking people of all ages to share their views and experiences. Similarly, we have worked in partnership with the organisations providing services and support. A diagnosis of sensory impairment is multidimensional, individual and life-changing. It impacts on a person's independence, self-confidence, self-identity, emotions, finances, social and all aspects of day-to-day living. One person said, "My whole world had collapsed." People see loss of vision or reduction in hearing as a sight or hearing issue and expect the health of their eyes or ears to be treated holistically. Right information, right support at the right time, in the right place, with the right person. Our engagement with West Sussex residents finds the NHS provision in West Sussex focuses episodically, one condition at a time, so does not address issues in a holistic way. Evidence from people's personal accounts suggests that those with more than one eye condition must seek a referral per condition and wait for further appointments. Whilst frustrating for individuals, this is likely to be more costly to deliver for our health and care agencies. Moving forward, there is a need for services to look at the well-being of the ears and eyes in a person-centred way to improve visual, physical and mental outcomes. Vision impairment adults. This engagement finds the eye health pathway to be fragmented, with the clinical element, GP, opticians, eye clinic, not communicating effectively with the non-clinical elements, community organisations. This means it is difficult to navigate the system, leaving people with unmet needs, which ultimately leads to isolation and frustration. Some examples of a disjointed pathway, or as one person stated, these cul-de-sacs need to be reduced. The eye clinics do not always provide or explain information about the eye condition to patients or refer to the non-clinical community organisations that discharge for emotional support. One person reported feeling brushed aside. This may arise for a number of reasons: clinicians not having holistic ownership or lack of patient involvement, or simply not knowing what is available. Whatever the reason, people are falling through the net and are not accessing the right level of support needed at the right time. The low vision service is different in each West Sussex district and can seem like a postcode lottery. There are sight care advisors in the south of the county and eye clinic liaison officers in the north of the county, but residents living in parts of Mid Sussex and Crawley are not able to access such a service. Even these services differ, as the eye clinic liaison officers do not follow the person through the health and care interactions, but the sight care advisor provides a more individualised and personalised experience. Many people spoke of the communication challenges they faced when trying to access health services. For example, IT systems not speaking to each other, leading to unnecessary and unacceptable delays, and appropriate paperwork being unavailable for an appointment, follow-up appointments not being communicated or cancelled. There were also concerns in how the NHS communicates with patients. Colour of paper used, font size, linked to web pages within letters, and mode of communication not being suitable for visual impairment. This was summarised by one participant who said he just needed timely access to information without stress and in a form that is usable. Communication of next steps is so important. Even though there is a comprehensive pathway, next steps need to be clearly stated to ensure understanding. This is important for people to be able to make informed choices and decisions. Our insights suggest it might be helpful for healthcare professionals to refresh their communication skills for how to impart distressing news from time to time. Other challenges included transport for appointments both within the community and to medical appointments, the impact of the environment of uneven paving, street clutter and parked cars, other people not understanding what the white cane represents. Finally, the psychosocial effect of a visual impairment diagnosis for the person, their families and carers is immense. Yet despite the pathway including access to local authority and community experts, the eye clinic are not referring all patients to these areas for support, prior or at discharge. Recognised best practice includes an integrated care model approach. Adult hearing impairment. The aim of the Adult Hearing Service is to maintain hearing capabilities for adults experiencing hearing loss with hearing aids. The White Paper, Equality and Excellence Liberating the NHS in 2012, extended the choices people have over their healthcare. The goal was to enable patients to choose the provider of their services, where appropriate, from a range of qualified providers. It is believed that extending the choice of provider enhances quality, improves access, and addresses gaps in inequalities. Key points to note. Given that services are provided by qualified providers, it is surprising to hear of the lack of information a person receives about their hearing reduction or loss and what happens next. Many people said they were unsure what aids tools were available to support them and have received little help with their emotional well-being and everyday support. Peer support seems to be provided from voluntary community and social enterprise organisations such as the Alzheimer's Society and other condition-specific organisations where hearing loss may be part of the condition. Many specific services seem to have closed over the past few years, leaving behind unfilled gaps. Communication accessibility was reported as a major issue for people with hearing impairment, and that lack of accessibility has made some people feel embarrassed. For example, West Sussex County Council pledged to follow the British Sign Language Charter, yet the West Sussex County Council Citizen Space Consultation Hub website is considerably difficult to navigate, not unusual for a local authority digital presence. New virtual ways of working have been challenging for some, as has getting online to access services. Some informed us that more support was needed for IT training to increase skills. Better service connections are also needed. Many people stated they prefer face-to-face conversations as they work better with hearing aids. However, some voluntary community and social enterprises organisations have accessible links to their websites, such as the Citizens Advice West Sussex. Physically getting to providers is challenging. Many people express that they have appreciated hearing aid batteries and equipment being posted to their home address. Psychosocial impact of hearing loss for a person is considerable, with feelings of being isolated and socially excluded and feeling unsafe. As unable to hear people from behind, other people's irritations impact on neighbours of TVs being too loud. Even those who have accessed social groups can feel isolated. More support with lip reading, sign language and tools to support the person, carers and families is needed. The effect of COVID-19 pandemic for adults with sensory impairment. There has been a big impact on routine appointments, eye clinics, removal of earwax, diagnostic testing, etc. Many appointments had paused, and some remain so, leading to deterioration in people's vision and hearing. People reported their confidence levels have dropped, having been locked away for 12 months. Many could not go out due to their inability to gauge social distance or the barriers this has created. Not knowing if they are 2 meters apart, unable to read posters on buses to know which seats are free, and not able to lip read due to face coverings. Some people have been verbally abused because they have not followed the social distancing requirements, such as directional arrows. One person stated, "My husband lives with dementia and wouldn't remember to follow arrows." A number of people reported feeling more isolated, with their walking having deteriorated, which added to their lack of confidence. Many shared their reluctance to rejoin face-to-face groups again, even though the loss of these services had a huge impact on them physically and mentally. One person stated, "In 22 years since diagnosis, I have never felt so isolated." Those who have been able to access the voluntary and community services via virtual meetings have found these helpful. In summary, our engagement shows there are gaps in the services provided and equitable access to some service provision. The services provided are not supporting in the round, as the limited psychosocial support occurs outside the Commission provision pathway and is provided by the voluntary community social enterprise sector. To ensure best outcomes, each pathway needs to embrace partnership working with the voluntary community social enterprise sector and provide full information on such provision. Children and young people with sensory impairment. As with the adult provision, from our engagement, we found that the current service provision is fragmented, poorly coordinated, and poorly communicated. The statutory service, health, education, and local authority, and voluntary and community organisations are not working together. In the main, this is a result of gaps of service provision, information, and knowledge, which can negatively affect the development and psychological well-being of children and young people, as well as increasing isolation and decreasing individual dependence and resilience. The pandemic stopped the regular health checks and exacerbated the inconsistent support received pre-pandemic for carers, parents, and children and young people. There are gaps in education support and in the knowledge of those who support children and young people, and a lack of knowledge working with the child with special needs. Much of the education support is currently being bridged by parents. Parents need the right tools to be able to support their child. It was suggested, for example, that British Sign Language training is made available for families. Often children have other long-term conditions as well as their sensory needs, which makes supporting them from a parent perspective more challenging. Many parents shared their uncertainty on where to go for support, as they had not received any information about which services can support, so are not able to engage with these. Some express real concerns about whether they are best placed to support their child's development needs, speech, independence, and day-to-day skills, as they've not been trained in these skills. One person stated, "I contacted various charities and was told my children are not blind or disabled enough." A number of support organisations have closed or are now really difficult to contact, especially for hearing impairment. Communication unsupported needs range from equipment, telephone, acoustic tiles or screens, less noisy environments for conversations, and using text instead of the spoken word. The COVID-19 pandemic has made things more challenging due to the wearing of face coverings and social distancing, which is difficult for many sensory impaired children and young people to understand or comply with. There has been much discussion of education catch-up following the pandemic, and this engagement highlights the importance of ensuring that the development needs of children and young people with sensory impairments and the support and advice provided to parents and carers are addressed in any local plans. Recommendations and next steps. Visual impairment recommendations. The recommendations are made to the Sussex Health and Care Partnership Ophthalmology Transformation Programme Board and to the West Sussex County Council and its Health and Care Scrutiny Committee. 1. The promotion of non-medical services to enhance independence, self-esteem, mental health and well-being should be embedded in all eye health pathways and procurement specifications, commissioning contracts. 2. Make sure that suitable information about the condition and associated support is provided prior to discharge and/or when a patient is referred to community services. Then they can be more health literate and prepared to benefit from support, which will help them to adapt to changes arising from their condition. 3. When reviewing eye health pathways, the commissioning of community services is important, as these can support patients' emotional, psychological and social needs, as community services and healthcare professionals working together ensures a holistic person-centred approach. 4. Transport to and from hospitals and hubs need to be included in the eye health pathway and commissioning arrangements, as visual impairment can make driving or using public transport unsafe, and to recognise that people may need additional support. 5. Include community organisations in the transformation workshops to ensure that a wider understanding of need is captured and informs the change processes. This could include a roundtable webinar for all professionals. 6. The ophthalmology programme and West Sussex stroke reconfiguration teams to examine the crossover between their work to ensure patients who have a visual stroke get prompt access to treatment and support to achieve better health outcomes. For all services that interface with people with visual impairment. 7. Communication and associated templates to be offered in a range of formats to meet different patient needs, at a minimum to appropriate to an audience with reduced ability to see. Standard printed material using at a minimum font size 14 in a simple typeface such as Arial, or avoiding forwarding instructions such as pressing phone options. Hearing impairment recommendations. 8. Enhance activities to achieve quality in access. For example, West Sussex County Council has pledged to the British Sign Language Charter, yet the West Sussex County Council Citizen Space Consultation Hub website used for the surveys is difficult to navigate. 9. The impact on quality of life should not be underestimated, and the promotion of non-medical services to enhance independence, self-esteem, mental health and well-being should be embedded in all hearing-related pathways and procurement specifications, commissioning contracts. 10. Review audiology services pathways to identify people who will always need an annual revalidation of deafness and those who do not, as their hearing will not be regained, to recognise the resource and the emotional impact on people. Children and young people's recommendation. 11. In line with the current Sussex Integrated Care System's transformation aspirations, our statutory health and local authority, voluntary and community partners need to work together to deliver appropriate services for children and young people with sensory impairment. 12. Information in one place that covers statutory and community support services for practical support, aids and tools, support groups, and so on, that is easily accessed when searched by keywords such as visual, sight loss, hearing, etc. 13. Visual map and hearing provision to identify the gaps in services for children and young people and their families, and identify how these gaps can be met in a sustainable and appropriately personalised way. A case study of when pathways work well to support people living with sight loss. This is Anna's story. Anna has Down syndrome and is 17. She has worn glasses since she was about 2 years old. Anna had corrective surgery on a squint when she was 4, and then wore bifocal glasses when at school to help prevent or prolong the need for more squint surgery. When Anna was at secondary school, her mum, at an optician's appointment, was shown through lens that what Anna's vision was like without glasses. The optician then put the lens in to show Mum her vision with her glasses on. She could barely read the second line from the top. The optician shared that Anna's vision just wasn't there, and you can't correct something if it was never there to start with. Mum knew from Anna's hospital appointments that Anna could read all of the lines, and some visits were better than others, but nobody had ever explained the implications of this. Mum contacted an expert at Cardiff University who specialises in people with Down syndrome and their vision. The expert explained that Anna's contrast and clarity was weak, and although it could always look beautiful airbrushed, so would the rest of the world too. The expert suggested that Mum contacted the hospital for a proper vision assessment. Everything then seemed to fall into place. Anna's reluctant to read. Anna was bought a paper-white Kindle and set the text for the boldest and largest font. Anna could enjoy reading again. The slow pace of writing off the board was not because Anna was cognitively slow, but because she struggled to see what she had to write. Maths always an issue, especially understanding the different symbols, plus and divide. Using the filter, Anna could barely see the difference. Discovering Anna had no 3D depth perception explained the horror of watching Anna cross the school car park, as Anna couldn't tell if the cars were stationary or what speed they were moving. Family now understands why on foggy days and in the dark, Anna would walk twice as slow and very reluctantly, as this reduced her vision even more. Films, especially at the cinema, weren't understood, not because of Anna's Down syndrome necessarily, but because the film action, etc., was all happening in a dark setting. So Mum began to narrate the film. This improved Anna's enjoyment of watching films. With the symbol cane and guidance from the Rehabilitation Officer's Visual Impairment (ROVI) team, Anna is much more independent. She is more able and confident in the kitchen due to new lighting, large display scales, bumptons on the oven, etc. Mum was given the Foresight Vision Support contact number by Worthing Hospital, as she has spoken with one of their sight care advisors. She stated, "She was amazing. She told me straight away why Anna was struggling to cross the car park and that I needed a symbol cane for her. She gave me the number of the ROVI team. She also told me to go to the Shore and Foresight Centre and went through various home equipment pieces and how bumptons worked. She showed me, because she had a visual impairment herself, how hard coin recognition is, and the coins she found tricky were exactly the same ones as Anna. She also told me how to make shopping easier for Anna." The ROVI team came to the house for an assessment. He brought bumptons, a white lamp, and an alarm for hot drinks. Mum had been told by the ROVI team to buy the sticky strips lead lighting to go under the kitchen cabinets to light the work service more for Anna. With the symbol came the Rover team taught Anna to walk to school, get the bus to college and go to the shops. The Foresight Care Advisor gave Mum the details for Bletchingham Court Trust, who were amazing. They bought Anna a Connect 12, which has been very useful. Acknowledgements. Healthwatch West Sussex would like to thank the following organisations for the support in this engagement: the Alzheimer's Society, Foresight Vision Support, RNIB, Carers Support West Sussex, Macular Society and West Sussex County Council. We would also like to say thank you to everyone who gave generously of their time to support this important piece of work. Thank you.